Per exam review, Canadian Practical Nurse Practice Test, 40 key questions. Question 1. A patient with liver failure is confused. Which finding should the nurse report first? Decreased consciousness, yellowing of sclera, decreased appetite, itchy skin. Decreased consciousness may indicate hepatic encephalopathy, a life-threatening complication. Question 2. What is the best way to ensure patient safety when delegating tasks? Verify the competence of the unregulated worker. Delegate all complex tasks. Avoid delegation entirely. Assume the worker knows how to do it. The nurse is responsible for ensuring the person has the skills for the task. Question 3. A Japanese-Canadian client is terminally ill and has many emotional visitors. The nurse should make arrangements for the family to visit, restrict the visitors, tell the family to be quiet, call the physician. Culturally competent care involves supporting the family's needs while managing care. Question 4. What is evidence-informed practice? Using research findings to guide clinical decisions, trialing untested ideas, relying only on intuition, doing what has always been done. It combines research, clinical expertise, and patient values. Question 5. A nurse finds a patient on the floor. What should be documented in the incident report? Facts: patient found on floor. Assessment: physician notification. Judgment: patient fell because he was careless. Nothing, if there is no injury. A note in the medical record only. Incident reports should be objective and factual. Question 6. A patient has chronic lung disease and is on oxygen. The nurse expects the flow rate to be 3 L/minute or less, 10 L/minute. Oxygen is contraindicated, only given during sleep. Low-flow oxygen is often necessary for chronic lung patients to avoid suppressing their respiratory drive. Question 7. A public health nurse is contact tracing for STIs. A contact demands the name of the source. The nurse says, "I must protect the privacy of all people involved. I will tell you if you tell me your partner's name." The source asked for anonymity. "I can only tell the doctor." Confidentiality is a key legal and ethical requirement in public health. Question 8. For a patient with a stage 3 decubitus ulcer on the right hip, which position is best? Left side lying, right side lying, supine, prone. Pressure should be kept off the affected area. Question 9. A patient begins to breathe rapidly. The nurse's first action should be obtain oxygen saturation level, notify the physician, give a sedative, check blood pressure. Assessing the patient's oxygenation status, SpO2, is a priority assessment. Question 10. Which developmental stage involves intimacy versus isolation? Young adulthood, adolescence, middle adulthood, toddlerhood. Erickson's stages: young adults focus on forming close relationships. Question 11. What is the primary goal of palliative care? To provide comfort and improve quality of life, to cure the underlying disease, to hasten death, to limit all medications. Palliative care focuses on symptom management and quality of life for those with serious illness. Question 12. When mixing regular and NPH insulin, which is drawn first? Regular insulin, NPH insulin. They are never mixed. The order doesn't matter. Regular, clear, is drawn before NPH, cloudy, to avoid contamination. Question 13. A nurse is teaching a patient about a low-sodium diet. Which food should be avoided? Canned soup, fresh fruit, grilled chicken, steamed vegetables. Processed and canned foods are typically high in sodium. Question 14. The principle of beneficence means doing good for the patient. avoiding harm, respecting choices, being fair. Beneficence is the duty to act in the best interest of the patient. Question 15. What is the most common sign of a urinary tract infection in an elderly patient? Confusion, fever, flank pain, dysuria. The elderly often present with atypical symptoms like altered mental status/confusion. Question 16. A nurse is assessing a patient with a cast. Which finding is most concerning? Inability to move toes, itching under the cast, pink skin color, warmth to the touch. Inability to move or loss of sensation can indicate compartment syndrome. Question 17. What is the correct way to identify a patient before giving medication? Check the ID band and ask the patient to state their name. Check the room number. Ask the roommate. Check the name on the door. 2 patient identifiers are required for safety. Question 18. A patient refuses a treatment. The nurse should explore the reasons for refusal and inform the physician. Force the patient to take it. Ignore the refusal. Tell the patient they will die without it. Patients have the right to refuse. The nurse must ensure they are informed of the risks. Question 19. Which position is best for a patient who just had a liver biopsy? Right side lying, left side lying, supine, high Fowler's. The patient is placed on their right side to apply pressure to the biopsy site to prevent bleeding. Question 20. A nurse notices a colleague appears intoxicated. The nurse should report it to the supervisor immediately. Ignore it this time. Tell the colleague to go home. Offer them coffee. Protecting patient safety is the primary responsibility, which requires reporting impaired practice.